there, my name is Maddie. I'm going to be your student nurse for today. Can I have you tell me your name and your date of birth, please?
Allie Mann and 3/27/2000.
Thank you. I'm just going to verify that on your wristband. Thank you, Allie. I'm going to give you a little privacy over on this side. And I'm going to wash my hands really quick. Alright, Allie, so I'm going to be doing your assessment today. But before we get going, do you have any spiritual needs that we can address or any changes in your healthcare that we can make for you?
I don't think so.
Okay. Can you tell me where you are today?
I'm at George Fox
At George Fox. And can you tell me why you are here?
for a physical assessment.
Physical assessment. And can you tell me the date?
It is the 22nd of April 2021.
Thank you. So you are awake, alert, and oriented ×4. And can you tell me a little bit about yourself? Just kind of like are you working right now? Or are you a student?
I'm a nursing student and I work as a barista.
Gotcha. And do you smoke at all?
I do not.
Okay. Do you drink alcohol?
No.
And how about caffeine? What does your caffeine intake look like?
About 1 cup of coffee a day.
1 cup of coffee? All right. So I'm noticing as we're having our conversation that your mood and affect are consistent. I don't have any concerns there. And that your speech is clear and articulate. All right. So we're going to go ahead and get started here. So what brings you in today?
I've been having a really bad headache.
Really bad headache?
Mhm.
Okay. Can you tell me about when that first started for you?
About 4 days ago.
4 days. And location. Is there a certain spot that it hurts more?
The temples and sides of my head.
Okay. And the duration. So is it constant? Does it come and go?
It's pretty constant, but it feels better in the morning and gets worse throughout the day.
Gotcha. And then how would you describe the pain?
It's dull and constant, but then sometimes it feels really sharp.
And then does anything alleviate it or make it better for you?
Sleep and ibuprofen usually help.
Sleep and ibuprofen. Does anything aggravate it?
I don't think so, no.
Nothing aggravates it. All right. Does the pain radiate at all from that area that you mentioned before?
Yeah, a little bit.
Okay. And we already talked about the timing. On a scale of 0 to 10, 10 being the worst pain you could possibly imagine, and 0 being no pain at all, I feel great, where would you rank that?
A 4 out of 10.
4 out of 10? And is that all the time, or is that just right now?
All the time.
All the time. Gotcha. All right. Well, I'm going to start taking your vitals. Do you know what your usual blood pressure reading is?
115/85.
15. All right. Well, I'm going to give you this pillow here. It's a little bit more comfortable. Yeah. This one here through you. And if you wouldn't mind holding this for me, thank you. All right, I got 119/78. Okay, so go ahead and take that off for you. And I'm going to take your heart rate here. So I'm just going to have you focus on. Okay? And feel free just to breathe normally here for a second. rate was 76 and your breathing was 12. Inspiration. I'm going to go ahead and put this pulse oximeter just on your finger. There we are, and I'm going to take your temperature. 99.4. And I'll give this a second here. All right, you're at 99% on room air. All right, so we're going to move into your cardiovascular assessment. So have you noticed any chest pain, any palpitations or dizziness?
Nope.
Nothing today? Okay. Well, if you don't mind, I'm going to take a listen to your heart here. And you can feel free just to breathe normally for this part. For this part, I'm going to be listening to your carotid arteries, so I'll just have you hold your breath for a second while I'm doing that. Just breathe in. Okay, exhale. And I'll have you breathe in again. Exhale. All right, so I'm going to flip this over to the bell and go over those same points again. And one more time up here, have you hold your breath. And you're good to breathe again. All right, so I noticed normal S1 and S2 sounds, and I didn't notice any murmurs, lifts, heaves, or pulsations. All right, so I'm going to be passing over these, so have you hold your arms out for me. Noticing your pulses are symmetric, and so is the amplitude. I'm going to do your posterior tibial pulses here. Okay, and dorsalis pedis. Thank you, Allie. All right, and as far as your lungs today, have you noticed any shortness of breath, coughing, or sputum production?
Nope, none of that.
Nope, okay. Are you all right if I listen to your lungs?
Mm-hmm.
Okay. So as I'm doing this, each time I press it up against your skin, I'm just going to have you breathe, take a deep breath in and out, and let me know if at any point you're starting to get dizzy, okay?
Okay.
Break for a second, and I'll come around the back here. Are you feeling lightheaded at all?
No.
Okay. All right, so same thing back here. One more time on the sides here. And on the other one. All right. There's a lot of deep breathing. Thank you so much. All right, and we'll have you do it one more time here. I'm going to check for bilateral lung expansion. All right. I'm not noticing anything out of the ordinary there. And as far as your lungs, I didn't notice any wheezing. There's no crackles in the bases. And when I was palpating on the back, I didn't notice any crepitus. Okay. So, I'm still gonna need this. If you wouldn't mind, the rest of the examination is a little bit easier if you're lying down. All right, so we're gonna be doing your abdominal assessment. So I have a couple of questions for you. When was your last bowel movement?
This morning.
This morning? Okay. And can you describe the color and consistency?
Brown and soft.
Okay. And was that pretty normal for you?
Yes.
Normal for you? Okay. And about how many bowel movements do you have per week?
7.
7? Okay. And have you noticed any nausea or any vomiting
Nope.
recently? Nope? Okay. I'm going to go ahead, and if you wouldn't mind pulling up your shirt here. So I'm just inspecting, I'll move this up a little bit. Alright. So I'm just inspecting the contour of your abdomen here, and I'm noticing that it's flat, which is to be expected. I'm gonna go ahead and listen really quick. So I'm gonna be listening in all 4 quadrants. Alright, and I'm noticing that your belly tones are normoactive. Now I'm going to be palpating for this next part, so do you have any areas that are painful before I do that?
No.
No? Okay. Okay, I'm going to palpate your suprapubic region. Is that tender at all? Okay. And I'm not noticing any distension. Now I'm going to palpate a little bit deeper this time, so let me know if it's a little bit too much. Okay? Alright. Perfect. So if you had a Foley catheter inserted right now, I would assess it for irritation, leakage, and drainage, but you don't. So if you don't mind, you can go ahead and put your shirt back up. And you can sit up if you'd like for this part. So for your last time you peed, was that this point today or what time?
About an hour ago.
About an hour ago? Okay. And can you describe the color, the clarity, and odor if there was one?
It was yellow, it was clear, and it didn't smell like anything.
Okay. Have you noticed like any new like urgency, whether that's during the day or at night?
No.
Okay. And no burning sensation?
Nope.
Okay. That is good. All right. We're gonna go ahead and move on to your eye assessment here. So do you have any sensory deficits, any changes in your vision, your hearing, your sense of smell or taste?
Nope.
No? And do you wear eyeglasses or hearing aids?
I wear glasses only when I'm reading.
Only when you're reading, okay. Well, I'm gonna have you stare at that silver plate on the back wall there. I'm just gonna shine this light in your eye. Okay, one more time. And again over here. Okay, and then if I would just have you stare at the tip of this pen here, and that one in your head. Alright, so your pupils are equal, round, and reactive to light accommodation. I'm going to go ahead, I'm looking at your face, I'm noticing that it's symmetrical. Can I have you smile for me? And frown. Thank you. Okay, so as far as your skin goes, have you noticed any irritation or is anything itchy?
No.
No?
Not that I've noticed.
Okay, I'm just observing your skin here. I'm noticing that it's consistent with your racial heritage. I'm not noticing any erythema or cyanosis, no wounds, incisions, bruising, or skin breakdown. Don't have any concerns there. I'm going to go ahead and pinch your skin here, checking for skin turgor. That's good. You don't seem to be dehydrated. I'm going to check capillary refill, less than 1 second. here. And I'm not noticing any clubbing. If you had an IV site in, I would assess that for erythema, drainage, or leakage, but you don't. And the same thing goes with drains or tubes. I would assess to make sure that they're open right now. I'm gonna go ahead and check your temperature really quick, if that's okay. Thank you. And I'm noting that your skin is warm and dry to touch. So I'm gonna do a Braden skin assessment. So I'm noticing you have good activity, you're mobile, I don't have any nutrition concerns, friction and shear. I'm gonna test your sensory perception in a minute here. So maybe I'll wait to give you your score. Actually, sorry, no. Can I just have you close your eyes, and I'm gonna press this against your skin and just tell me where you think it is. Okay?
My right arm. Left forearm. Right finger. Right knee. Left shin. Right foot. Left toe.
All right, thank you, Allie. So for the rest of your assessment, I don't have any moisture concerns. Your sensory and perception are good. So I'm gonna give you a 23 on the Braden skin assessment. Okay? So we're gonna do your musculoskeletal here. So what I'm gonna have you do is you're gonna raise your arms up like this, and I'm gonna apply a little bit of resistance as you're doing that. Perfect. And a little bit of resistance as you're coming down. Good. And you're gonna do a bicep curl for me. So I'm apply a little bit of pressure. And some pressure here. So moving down. Good. And now I'm gonna have you squeeze my finger as hard as you can on both sides. All right, and I don't have any concerns. That was equal bilaterally. Can I have you stand up for me really quick? And I'll have you take 3 steps that way and then 3 steps back to the bed. Thank you. You're good to sit down. Perfect. So it's assessing your posture, your balance, your gait. I didn't notice any muscular trauma. You didn't seem to have any difficulty with that. Was that pretty comfortable?
Mm-hmm.
Good. Okay. I'm gonna go ahead and do your deep tendon reflexes here. So just think about something else. Stare at the wall. Think about coffee. There we go. All right, so no concerns with your deep tendon reflexes. So +2 bilaterally. Let's see. I'm gonna go ahead and do plantar flexion here. So I'm just gonna apply a little bit of pressure on the tops of your foot. You're gonna point them up towards the ceiling. And I'll put some pressure here as you're pushing down. All right. Well, Allie, do you have any more concerns for me today?
I do not.
You don't? Okay. I was noticing throughout the exam that you followed directions really well. I don't have concerns there. I will take this information to the doctor, and he should be in really soon to see you.
Okay, thank you.
Thank you.